Welcome, everyone, to a brand new webinar with Laser and Skin Surgery Center of New York. We are very excited to be here today to talk about 2024 aesthetic rejuvenation. This is a panel discussion with 4 of our board-certified dermatologists who are going to be kind of giving you an overview on almost everything from injectables, body sculpting procedures, and lasers and skincare and overall skin health. We are very excited. We are here live today, so we will be available to answer as many of your live questions as possible. Each doctor has a short presentation prepared to educate you on their topics, and then we will open up for live question and answers. So without further ado, I am excited to get started. I would like to introduce you to Dr. Ronald Shelton. He is one of our board-certified dermatologists here. All of our dermatologists that are speaking today all offer most of the treatments that we're discussing with lasers, injectables, body sculpting, and skincare. But today, Dr. Shelton is going to educate everyone on non-surgical body contouring. He really is on the cutting edge of this, working with some of the brand new, the latest technology that's out there. And today he's even going to talk about some of the technology that's coming soon. So Dr. Shelton, whenever you are ready.
All right. So welcome. Thank you for attending our webinar. It will be recorded, and I'm taking advantage of that because I don't imagine that we're going to have enough time for me to read every single word on these slides, but you can go back when you're not involved with anything else in your life and read through because it is very helpful, I believe. So we're talking about loose skin, sagging skin. How can we tighten and lift skin without surgery? First and foremost, we can never do as great a job as a plastic surgeon to lift very sagging skin unless we do surgery. We cannot do the same with non-invasive treatments or minimally invasive treatments. But there are many reasons that people will not undergo surgery. Some people. But causes of loose skin, it's not just age. It can be very bad sun exposure as a youth, smoking, diabetes, and many other conditions. So in terms of how we can tighten skin, we can do that with multiple different modalities, but we don't have to wait for things to be loose. There's so many times people come to me and they say in their 30s, I look exactly like my father or exactly like my mother. And what can we do now to forestall the aging process? So there are many safe things that we can do. But let's have a little basic science review. If you're able to see what's moving on the screen, this is the dead layer on the top here of the skin that exfoliates and flakes every day. Underneath that is your epidermis. A lot of the living cells are originating from this bottom layer here, but the lighter pink color where the cursor is going right now, that is your dermis. That's your infrastructure, your supporting structure, filled with good collagen, the protein that helps support the skin, and elastic fibers. But when we were at the beach as a youth, when we used those reflectors or mineral oil with iodine, what we did on the lower screen, all these blue fragments that you're seeing here are damaged elastic fibers. So instead of these nice coiled springs that can go back and forth, and lift skin, we're looking at the bottom screen now, they're all shattered. These elastic fibers are fragmented and they're just sitting coiled up in our dermis and the infrastructure, taking up space, not doing anything. So if we pre-treat with a topical serum that can help improve our fibroblast production of new collagen and new elastic fibers and try to take away some of those damaged elastic fibers, we'll have better room and primed skin cells to deliver and produce more collagen and elastic fibers after our energy-based devices. So I normally recommend vitamin C by mouth because we may not have enough in our diet, even if we think we do. And we need vitamin C to develop collagen. And then the topical serum to help promote fibroblast activity to make these. There's so many different devices and technologies in the past, some of which we're still using, like Thermage. ThermiSmooth or Peleve. These are external radiofrequency. Then ThermiTite is internal, minimally invasive with a lot of downtime. AccuTite, FaceTite, or another other devices of another manufacturer. And then we have the high intensity ultrasounds, Ultherapy SoftWave. There's laser resurfacing. Dr. Bernstein will speak about that. Microneedling with radiofrequency, we consider more for texture, fine lines, acne scars, maybe a little tightening, but not real lifting. There are lots of different brands on the market. And here's external radiofrequency. So it's a spa-like treatment, needs several treatments. This, for that treatment, is a home run. Many patients do not develop as good an improvement with ThermiSmooth external radiofrequency. Here is a combination of intense ultrasound on the forehead and then the thermage radiofrequency on the upper eyelid, so we gain a little more lift of this hooded skin compared to before, where we have just a few millimeters of skin before the eyelashes. We've almost doubled or more than that of the skin above the eyelashes here. Microneedling radiofrequency, I just mentioned, it's not the greatest lifter, but in some patients can help these laxity, the horizontal creases, these weak bands of the muscle usually don't improve that much. This patient has better than average, but she does have a better jawline for sure than before we started. Here's another view from the front, again, of these platysmal muscle bands improving slightly. Many patients don't get enough. This is ultrasound. So it's showing that a fractionally delivered, not 100% surface area of ultrasound is heating up the dermis exactly where we want to help produce more collagen and more elastic fibers.
Hi, I'm Dr. Ron Shelton from the Laser and Skin Surgery Center of New York. Welcome. Today we're talking about SoftWave high-intensity ultrasound for facial and other body site skin tightening. One great advantage of these devices is that there's no downtime at all. It's very safe for all types of skin. We call it colorblind. And similar to its predecessor, Ultherapy, SoftWave is a very easy treatment to go through with medication to help minimize the pain as an outpatient. A whole face can take about an hour or less to treat. Face and neck is often done at the same time. A SoftWave brow lift is done to help tighten the skin of the forehead and the upper component of the eyelid right below the eyebrow to help that saggy skin, what we call hooding, if someone is not yet ready for a plastic surgeon to do what's called a blepharoplasty, or cutting the excess skin of the upper eye. The jowl on the cheek that descends across the jawline, again, if not ready for a facelift, SoftWave and sometimes the combination of the Ultherapy can increase the tightening and lifting. Sagging necks, similarly. And other areas on the body that have crepey skin, whether it's on the belly, whether it's on the arms, or even the thighs. No downtime. It's colorblind, so we really can do it on any patient's skin of color. It doesn't matter. So please come in for a consultation so we can discuss this great technology.
So for the SoftWave, this is a reasonable result. And I say often to my patients' consultation, it's somewhat capricious. We will look at a patient like this and say, I don't think you're a good candidate. You're a little older, you've had some sun damage, you have crepey skin, you have bulging here, you have a jowl, but the patient doesn't want surgery. They're willing to undergo the treatment, and voila, she had a better result than expected. Conversely, there could be a younger person with less to do, less sun damage. We think that's going to be a home run, and then we actually don't even see much improvement. That can happen. Fortunately, the majority of patients are satisfied. It has a high satisfaction rate for sure. This is the same patient, just a different view. So again, the crepiness, but you see these platysmal muscle bands really haven't changed much. And here's hooding. This is a far better result than I would have imagined for this patient or any patient. So this was a home run. And here, the jawline is markedly improved. And what I'd like you to focus in on these treatments, if you notice there's depression here. The mid-cheek has lost volume over time. That means there's less support. That means the skin starts to sag. We get more folding, we get more jowls. When we do soft wave therapy energies that deliver more collagen and elastic fibers, we will lift structures and replenish that volume loss without fillers in many patients. This is a combination of ultherapy and soft wave on a patient, and you can see much smoother from here to here, the tighter jawline, less deep folds. If you look at her jowl here, you can start to see improvement right over here. Similarly, look at that cheek, depressed, volumized, no filler. Cellulite skin laxity, what's the difference? Like a mattress button, we have dimples. They can be on the thigh, much more common on the buttock, and these dimples can respond to different treatments. Skin laxity, however, are creases, usually horizontal, from skin that folds on itself. It's treated differently, and we have a much more difficult time to get a good result with skin laxity than we do with actual cellulite. There's some treatments that virtually no longer are done, but Avali is a minimally invasive procedure with local anesthetic to get underneath the cellulite and divide those vertical collagen bands that are holding the skin down, creating the dimple. Soft wave, we've just mentioned for skin tightening. If you tighten the skin, the cellulite may look a little better. Resonic acoustic energy, literally without invasion, without any invasive procedure, can break those bands and improve the cellulite with very little, if any, downtime. So this is resonic acoustic energy for cellulite, and this is a very good result. And here's another patient. Very good result. So again, no downtime. ThermiTite, minimally invasive radio frequency, a lot of downtime, swelling, bruising. But if they don't want the incision of a facelift, we can make with just a little needle hole the entry for the anesthetic, and you're awake, and we can get a beautiful result like this. And this is the Avali, minimally invasive subcision, if you will. We actually will cut the bands from underneath through one little incision. So there's usually not even any stitches involved. And this is at 6 weeks. So thank you very much for attending, and we'll take questions later.
All right. Thank you so much, Dr. Shelton. I was able to figure out the technical difficulties, so I think it is time to go back to Dr. Anolik now. All right. Please give me some thumbs up if we can hear.
Some of the recent innovations in cosmetic dermatology injections. Every year we're seeing new ideas, concepts, and uses of what we're using in the field. And as many of you know, we have a clinical trials unit that we work on here actively. And fortunately, we're part of a lot of these developments. Cosmetic dermatology injections really mean by and large, a category of neuromodulators, which are things like Botox and Dysport and many other products you may have heard about. And the other big category is augmentation fillers. And so I want to talk about some new concepts in those two fields. So there's a new hyaluronic acid injectable that we are using and excited about. These hyaluronic acids are becoming more than just volumizers, and we'll go into detail. And there's also a longer lasting neuromodulator that we're using. And I do think that these have a time and a place that I want to discuss. So with regard to the novel hyaluronic acid, it is known as Juvederm Skin Vive. So what is hyaluronic acid? It is a natural sugar chain molecule, and it's already found in our skin. It's part of our skin anatomy, our skin function. It's something that we use commonly in dermatology, but under many uses. Many people have heard about it purely as an ingredient in moisturizers. A lot of tweens are going on TikTok learning about skincare, and a lot of them know about hyaluronic acid being a great moisturizer. And the reason it is a great moisturizer to put on the skin is because it has a strong ability to attract water. Hyaluronic acid is also the most popular filler material. There are others, but the most popular are the ones made out of hyaluronic acid. And those are big brands that you probably have heard about if you're familiar with our field. And those include things like Juvederm, Restylane, Belotero, RHA, and we're going to see more and more coming about, and they all have different properties and benefits. Some are a little stronger and firmer for lifting on the lateral parts of the face. Some are a little bit softer to add volume, sometimes in the areas of the lip and the chin. So there's a variety out there that we choose from. Skin Vive, this newer hyaluronic acid injectable, really merges the concept of hydration of a moisturizer and an injectable component of hyaluronic acids. It's really a new class of in-office dermatology treatment. The injected hyaluronic acid of Skin Vive improves skin quality through the hydration as opposed to the volumization that we see with, I'm sorry, I'm getting something on my screen here. Okay, as opposed to volumizing. So I like this visual because it's a little bit of how I see my use of Skin Vive. I can now deliver hyaluronic acid droplets in the top layers of the skin, giving our patients long-term hydration and visible smoothness. I put together a little video just to show you what it looks like to have this done. So here we go. So you can see that I'm using the syringe and injecting just tiny droplets right in the deep dermis and underside of the skin. Almost like in a grid pattern. If you're a patient, you might also recognize Trish, who I'm treating, who you may know has a good sense of humor and either just told us a joke and that's why she's smiling, or she's laughing at one of probably our dumb jokes. It was actually a very tolerable procedure because the needle is so fine. She didn't even numb for that procedure. This is an image from some of the clinical trials that Allergan organized when they were getting the approvals and defining how to use Skin Vive. In this case, you can see baseline versus a month, and I know it's sometimes hard to see on PowerPoint, and I hope the lighting does reveal it, but typically the skin looks a little softer and a little bit brighter because of the hydration of the hyaluronic acid Skin Vive right under the surface of the skin. The clinical trials showed that patients who received Skin Vive reported very high satisfaction with their skin appearance. And patients also described that their skin was glowing, hydrated, refreshed, and healthy for up to 6 months after treatment. So who doesn't like the idea of that? So this is why it's been popular among many of my patients. And now I wanted to move on to neuromodulators. So we're moving away from hyaluronic acids in the office and instead a new concept in the use of neuromodulators, in this case, a brand known as Daxxify. So neuromodulators in general is an entire category of injectables, different than augmentation fillers, that reduces lines caused by muscle contractions. So the classic example is the 11 lines between the brow where the muscles contract, make wrinkles that we don't need. This category includes things like Botox Cosmetic, Dysport, Xeomin, Jeuveau, and now Daxxify. I thought it would be interesting to go into the technical side of things a bit. for those of you who are curious. This is essentially my attempt to describe the mechanism of action of FDA-approved neuromodulators. If you imagine the yellow line there and above, that would be the cell of the nerve. The pink line and below would be the cell of the muscle. And what I'm trying to show here is that there are these little balloons, we call them vesicles, that are full of these little black dots, which represent a molecule called acetylcholine. And that approaches the membrane of the nerve, and it releases the acetylcholine, or these little black dots, into the junction, which touch the muscle and cause the muscle to contract, and the muscle creates the wrinkles that some we want, and some, like the ones between our eyebrows, many people don't want. Those little balloons or vesicles can't just join the cell membrane and release and affect the muscle, because if that happened in an uncontrolled way, we'd be contracting our muscles irregularly. So there are some proteins that are in our cells that allow us to release those little balloons, and they're called snare proteins. So the way these neuromodulators works, represented by this BTA that you see here, it holds onto the membrane, enters the membrane of the nerve, and it has the ability to cleave some of these proteins known as snare proteins, so that little balloon cannot attach to the nerve membrane and release and make contact with the muscle. So it cleaves that little protein, and then it no longer can attach and release the acetylcholine for the muscle contraction. Daxxify is a new, what we call botulinum toxin type A product, which is essentially what the neuromodulators are. It integrates a stabilizing, positively charged peptide. And this peptide can bind to the neuromodulator molecule, and it also can bind tightly to the cell membrane of the nerve. The idea is that the neuromodulator protein is able to survive transport more easily from the vial to the syringe and into the skin, making the impact that we want, and it can get absorbed even in greater quantities into the nerve, creating a greater impact that we're trying to achieve. In this case, the neuromodulator there represented the BTA is there, but imagine that there's a stabilizing protein around it, allowing it to bind more easily. In fact, more would survive transport getting to that nerve membrane, and more can be taken into the cell and causing the breakdown of those proteins that can prevent the contraction of the muscle and prevention of the wrinkle that we're trying to achieve. These are some photos from the clinical trials, and you can see at baseline, the patient has pretty deep lines. And at 4 months, which is the bottom left photo you see on your screen, the 16-week period, you can see that she still has some benefit from the treatment with the neuromodulator. The lines are not nearly as deep as they were to begin with. And even out to 6 months, you can see lines starting to creep back, but we're getting a nice duration that extends past that 4-month mark, which is what we're used to seeing as an endpoint, where the benefits of the neuromodulator and the diminishing of the wrinkles is still present. So it's pretty exciting. So who is the best candidate for this sort of longer lasting neuromodulator? It depends. The traditional neuromodulators that we've been using for many years are still wildly popular for many reasons. A longer lasting version would be popular among those people who will not be able to return 3 times a year, or just cannot. They choose that they don't want to be in an office so frequently, or some of our patients live in Europe or Asia or South America, and they just can't be here as frequently. So they make a good candidate. People who are not really desiring the opportunity to be able to tweak the benefits of what we're trying to achieve are also good candidates. Some people like the idea that between 3 to 4 months, they can come in and they can modify this area or this area. And if you use something a little longer lasting, you really can't modify that anymore. And then, of course, there's tremendous benefits to these procedures, but there are, of course, always some level of risk. And those low risks, which are present, could last longer if they occurred, and we use something that lasts theoretically longer. So in conclusion, there are a lot of innovations in our field, including the hyaluronic acid injectables, and we're now able to deliver smoother and hydrated skin using SkinVive. And we're also using a novel neuromodulator that allow us to extend the duration of effect of the neuromodulator, in this case with Daxxify.
Amazing. All right. Thank you so much to Dr. Anolik, who will see us say that in the recording. All right. So next up, I am very excited to introduce Dr. Leonard Bernstein. He is also a board certified dermatologist, and he's been with LSSC for many years now. How many years has it been, Dr. B?
It's been here since 1995, so almost 30 years.
Wow.
I'm
He is
old.
Amazing asset. If any of you guys have met him, you know why. He's amazing. And today he's going to be speaking about laser resurfacing and laser treatments. So, Dr. Bernstein, take it away.
Okay, so this is a huge topic. It's more like a half an hour to an hour discussion. We're going to compress it to about 5 minutes. So, cause of the aging face. We already talked, Dr. Shelton and Dr. Anolik kind of spoke a little bit about things that happen with the aging face. And there's natural aging, which is like loss of elastic tissue, fat volume loss, which fillers are very appropriate for, bone resorption, which happens to all of us as we get older, usually in the upper cheeks and around the mouth. These cause lots of loss of volume in the face. There's photoaging, which is due to too much sun. Prominent blood vessels appear on the face, brown spots, crepey texture, and also elastic tissue damage, which Dr. Shelton mentioned. And then there's lastly is disease and medicinal induced changes like rosacea, or people who have collagen vascular diseases, or who use too much cortisone on their skin or internally. These can all cause changes in the skin. And what do we do? There's lots of different types of rejuvenation things that we can help with the skin. Topical agents, fillers, botulinum toxin, Dr. Anolik just spoke about, and then lasers and resurfacing, which is huge. So most patients, when they come to the office, they have many things going on in their skin. It's like not just rejuvenation of the skin of facial resurfacing. It's like, what do I do for my blood vessels? And there's different types of blood vessels. There's the dilated red veins, we call telangiectasias. There's prominent blue vessels we see under the eyes, commonly diffuse redness we see in diseases like rosacea, or people who flush very easily with alcohol or stress or spicy foods. Angiomas are these little red blood vessels that come up on our skin, sometimes during pregnancies and children, and vascular birthmarks, which we see hemangiomas or capillary malformations in babies. And there's lots of different lasers that we use. We use pulsed lasers, the KTP lasers, intense pulse light devices, which we don't use as often in our office. And some people even use alexandrite lasers. And this is the example of the pulsed lasers. Very bright light. So when our patients come into the office, we all have glasses on. Patients' eyes have to be covered. And we're just shooting a beam of light through the skin. And it's there's a cool spray that fires before the laser does, and that cools the surface down. So the epidermis here is protected while the laser light can go down into the blood vessel and heat it up and hopefully destroy the vessel and remove the blood vessel from visual sight. And this is some good examples of the pulsed laser for treating facial vessels. On the nose, here in the bottom left, is a little port wine stain, nicely resolved. And then these larger, big caliber vessels on the nose also can be treated. Sometimes we'll use the settings that have bruising associated with the pulsed laser, which can last for about a week. But often we can treat these lesions without any bruising. It's just a short-term recovery. The XLV laser is another yellow light laser, green light laser that we treat these like very discrete red blood vessels on the skin. They respond very nicely. It's almost like taking an eraser, almost immediate effect. You can have some redness and swelling after the treatments, but they respond well. And these are parts of the photo aging process, which are very quick and easy to resolve, much easier than wrinkles. This is more blood vessels on the nose, some broad redness on the cheeks. And these are the reticular vessels, these blue veins underneath the eyes, which respond really nicely to treatment with the longer pulse YAG lasers. Pigment, the other big issue with aging. These lesions are mostly like freckles and brown spots from the sun. They can be birthmarks as well. And we have several different lasers. Everyone's excited about the picosecond lasers, but we have a whole host of lasers which we still use, even going back to 1995, like the ruby laser and the ND-YAG lasers, which are still very, very useful. The thulium laser, which is the Fraxel device that we use very commonly in our office, has a great effect on brownness as well. These are just some pictures of some freckles that were treated with different lasers. This is the ruby laser. This is the picosecond laser. You see some nice resolution. And this is what it looks like immediately after. In the middle picture, they get a little whitening of the skin that lasts for about 15 to 20 minutes. And then within a week, it forms like a little brown crust on the surface that peels off like dried paint. And then within a month or so, you have nice skin again without having the brown spot. Very easy to do. Often don't need anesthesia for this type of procedure. Melasma, which is a very common problem, can be treated with the low energy thulium laser, which is similar to Fraxel, same device, but much lower energy. Melasma does not respond well to high energy, so people sometimes get nervous about using the standard Fraxel device. The thulium low energy device is very safe and After a few treatments, the melasma nicely resolves. Although it's not cured because melasma can return, but it does lighten it nicely. The resurfacing lasers that everyone's excited about. Goes way back to when I first got here in 1995, the ablative CO2 lasers, going all the way to the newest lasers, the Elicor, which is not a laser, but it's a microcoring device. It's the latest device we're using for resurfacing. The microneedling with radio frequency, which Dr. Shelton mentioned briefly. We'll talk about these over the next few minutes. Just to briefly kind of show what these technologies are doing, we're all trying to heat up the middle layer of the skin, the dermis. The epidermis is, again, is essentially not what we're looking for in terms of wrinkles, but we're looking for the heating up the dermis to create collagen, remodel scar tissue, improve the texture of the skin. Some tightening can also be seen, but mostly it's about texture. Going on to the old-fashioned ablative CO2, which we did back in the late 90s into the early aughts. We had some really tremendous improvement of the skin. This is one treatment with the CO2 laser. The downside to it is we had people had developed scarring when they misused the machine and became a very public spectacle on shows like 48 Hours and such. But one of the things we noticed was we had some patients, not that many, but about 10 to 15% of patients developed this permanent whitening of the skin when you treated small areas like this. Even when we treated large areas, you could see it, but you see it less because of the transition zone by the jaw. But this was considered unacceptable. And by 2001, 2002, we pretty much stopped using fully ablative CO2 lasers for that reason. Fractionated lasers came up in around 2005, and the whole concept was to use the same types of lasers, but to actually spare the skin between, called bridging. So this area of untouched skin was allowed to heal and allow the skin to heal without that scarring, without that whitening of the skin. And the pattern on the surface of the skin looking straight down looks like a grid pattern. So all these little pulses where the laser light went through the skin, but the untouched skin nearby was the area that allowed the skin to heal well without all these complications. And this became the standard of treatment around 2005, 2006. And this just goes to show you some of this is the CO2 ablative fractionated laser, and you can see the holes that it creates, but it allows the bridge skin in between, which is untouched and normal skin, allows that area to heal quite nicely. And this thermal injury that's induced by the laser is what stimulates new collagen to grow in this area and allow the skin to improve in terms of the collagen as well as the wrinkles and texture. This is a good examples of the CO2 fractionated laser at 3-month follow-up. This is a 1-month follow-up. This is examples of the lip. You see some significant lines on the upper lip. And this is after second treatment, but 3 months later, you see some improvement of the upper lip lines. Fractionated non-ablative laser, which is the standard Fraxel dual laser, which we use today, and this is the workhorse laser. Most patients don't want the downtime associated with the CO2 lasers, but I didn't mention was that hole that was created in the skin requires about 5 or 6 days to heal. So you have scabbing and crusting for 5 or 6 days with the ablative lasers, but with the fractionated non-ablative 1550 nanometer lasers, the Fraxel dual, you don't have that problem. You have some redness, you have some swelling, and you do have some peeling and dryness of the skin, but you're not really out of commission. You could go to work the next day, although your face would be a little bit red and swollen, but you're not completely out of commission. This was the first patient. I call her patient 0. She's the one who actually sold us the device. She would come to our meetings, and she actually was treated by the company, the Reliant at the time, treated only one side of her face, and they left the other side untreated. And she would come to our meetings, and within the first few minutes of seeing this one, we basically all wanted to buy this device, and that's the beginning. I call her patient 0. But we've also had great results with our own patients using the Fraxel Restore and the Fraxel Dual lasers, and these are the non-ablative lasers, acne scars, photo damage across the chest. This is one of my patients who we treated recently who had a beautiful change on her skin after having significant photo damage and some fine lines. This is what she looks like when she's numbed up right before the treatment. And in the course of time over the next 5 or 6 days, see some really improvement of her skin in terms of the color, the texture, and overall brightening of her skin. This is another example of her. And you can see all the photo damage on the chest. This is immediately after treatment. You can see how red and irritated the skin gets after the first day, but it's not scabby or crusty. It's just kind of like dry and flaky skin. And this is her skin after healing. It's great for people who have actinic keratosis or precancerous skin. We found that we can resurface the whole surface of the skin and improve by turning over that top layer. We actually remove a lot of these precancerous cells. The latest technology, which everyone's excited about, is called Maria. It's basically using it's the same type of concept as the Fraxel laser, but instead of having a straight beam going down into the skin and forming columns of heat, now we're actually focusing that heat in a specific spot in the dermis that allows us to actually have a broader area of epidermal heating, which doesn't heat up to the significant amount to cause injury and as much irritation, and has lower risk for patients who have darker skin tones with regard to pigmentation changes in their skin. This is a newer technology that we can see some really nice tightening of the eyelid. If you can see this slowly over a period of 5 months, but we're showing it to you over a few seconds. You can see just the tightening of the skin. I can show you here with a few images of arrows showing that tightening of the upper eyelid. This is really just treating on the upper surface of the eyelid right here, and we're getting improvement, lifting of the brow. More examples of this overall treatment of the face. Its treatment is very similar to the Fraxel non-ablative lasers and treatment of the neck. So again, there's lots of different elective lasers. We saw the ablative CO2 lasers. We're going to talk about microneedling and coring next. Microneedling, or we use the Genius system. There's also Morpheus. There's multiple devices out there. The whole idea is that we're bypassing the epidermis by these fine needles that we put down into the middle level and deep levels of the dermis. Once we get the needles down to the point we like, we emit a radio frequency energy that creates a thermal reaction at that level, and that helps stimulate new collagen. So we do it at multiple levels on each treatment to allow us to get a nice evening of the thermal energy to the dermis without injury to the surface on the epidermis. This avoids things like hyperpigmentation and even downtime. Most of our patients have redness for a day or two, maybe a touch of swelling, but their recovery is much faster than we see with things like Fraxel and Fraxel CO2 laser. And we can see we can treat darker skin tones. We can treat neck and have some improvement of the texture of the skin of the neck, and also even on the folds and lines on the cheek. Microcoring at Alicore, which is the newest machine that we have that we use to help improve the skin. It's not a laser. Instead of using a laser light to make holes in the skin, we're actually using a physical needle that cores the skin, that makes little holes in the skin, and there's a vacuum device that sucks those little pieces of skin out, and we have these little holes that take about a week or so to heal. This is shows a transition over a period of about 1 week, seeing that you still have a little bit of pattern seen 3 or 4 days after the treatment, but by a week or so, most of that pattern of the grid is gone. And we see some really nice improvement in terms of jowls, in terms of tightening of the skin. It's not so much of a complete textural change, but it is some tightening of the skin. As you remove those little cores of skin, each of those little holes will heal and pull tighter and improve the texture. This is some scar revision by the ear. Also helps improve and makes the scar a little bit smaller in size. So there's lots of things to consider. There's pigmentation, there's blood vessels, there's volume loss, texture, loss of elasticity. And most of our patients don't require just one treatment. You have to do multiple types of procedures. So most of our patients will have a little bit of blood vessels treated, some brown spots treated, maybe some Fraxel resurfacing at the same time. It's not usually one process that treats everything. And the most important thing is prevention. Just sunblock, sunblock, sunblock. That helps save a lot of these problems from developing. And there's also topical medicinals that we'll speak about in a few minutes, about different things you can do at home to help improve the texture of your skin. Thank you again for coming tonight, and come visit us and we can help evaluate some of your skin for facial rejuvenation.
Thank you so much, Dr. Bernstein. I know lasers is a big topic. We could have gone on forever about that, but I appreciate you trying to summarize it for us and at least give people a little bit of information. And like he said, you know, definitely if you come in for a consultation, we can get more in depth. So last but definitely not least, we have the one and only Dr. Blair Murphy-Rose. She is going to be speaking today about healthy skin and aging and proper skincare. And she is definitely the person to be speaking about that because this past year, she even launched her own skincare line called Skincare Junkie. So Dr. Murphy-Rose, take it away.
Thank you. Can you hear me?
We can.
Perfect. Okay, so my colleagues have touched on so many of the great things we can do for skin, and some of the aging face we'll talk about. It's sort of been touched on, but in case anything was missed for those jumping on a little late, the aging face is due to many things. One of them is volume volume loss. So we know that the fat pads are changing. They're shifting and we're losing fat as we age. Bony resorption also occurs. So the bones that used to be a little higher are coming in closer into the inside of the skin. That affects the scaffolding. This starts by age 25 and it's already significant for many by age 35. And we see increased skin laxity. So patients, not a day goes by, I don't see a patient come in complaining about skin laxity and starting to see the changes, or they're at their advanced stages. And why does this happen? Well, we know that we're losing collagen and elastin in our skin about 1% every year from the age 20, it's believed. We also lose the capacity to retain water over time, or it becomes reduced. And we'll talk a little bit more about this and ways we can work at home in addition to the in-office devices that are offered to help to prevent the changes from occurring and to treat those that have occurred. So this is sort of just a little diagram of over the years, over the decades, we see the changes occurring. We see this sort of inverted triangle, as it's called, where those changes are occurring, fat pads are shifting down, bony resorption's occurring, and the skin is just losing its ability to stay where we want it to stay and to snap back when, folded. So my colleagues have spoken, given us a nice breadth of the in-office treatments available, from ultrasound technology, soft wave being one of my favorite devices, radio frequency and with itself or with microneedling, laser treatments and injectables. But what can we do at home to, help to prevent these problems from happening, these skin changes from occurring, and also treat those. So like I said, I just wanted to touch in case anyone missed before. Dr. Shelton gave us so much great information about SoftWave, and the providers and myself have seen such nice results with tightening of the skin with no downtime. So this is just one of my favorites. And then at home. So many things that are important to keep your skin youthful, preserve the youthfulness, and keep it healthy. A healthy lifestyle is important. We know that a well-balanced diet is important. As Dr. Shelton mentioned, vitamin C, for example, is an essential cofactor in the production of collagen. So making sure that you're getting all of your fruits and vegetables, enough protein to keep your hair and skin healthy is very important. Adequate sleep, reduce stress as much as possible. We know this has an effect on the collagen in the skin. Avoiding smoking, decreasing pollution as much as possible. These are all things that can help your skin. Sun protection is very important, and we'll talk a little bit about that today, why it's so important. And then we'll go into some of the 5 skincare essentials that I think everybody should be using. So first of all, we'll talk about, so we're going to go through cleanser, a topical antioxidant, a vitamin A derivative like a retinol or a prescription retinoid, or if pregnant, a retinol alternative, a moisturizer that really virtually every patient should be using, and sunscreen, of course. So cleansers. Most dermatologists will recommend you use a gentle cleanser. So free of any of the actives or harsh ingredients, soap-free, pH balanced for a slightly acidic pH that is normal to our skin and that's non-drying or stripping. I want to make everybody aware that if, some people say, oh, I love this, it gives me this tight feeling after cleansing. You actually really don't want to have that tight sensation. That's sort of a sign of a mild irritant dermatitis, means that that's not the right product for you. And most people should clean their skin 1 to 2 times daily. So that either means in the morning and the night, or just in the night if you have drier skin. I like to recommend to my patients that when you wake up, if your skin feels sort of oily or greasy, you're somebody that should be washing your face in the morning. If you wake up and it feels sort of normal or dry, you can skip that cleanse. If you feel like you need something, sometimes a little micellar water like this Bioderma product is a nice way to get that sort of clean feeling without stripping too much of the natural oils that we need to keep our skin well hydrated. And so we'll talk about sunscreen. Well, why do we need sunscreen? This is sort of a famous picture that came out in the New England Journal of Medicine in 2012. This was a truck driver who had a significant amount of sun exposure on the left side of his face as compared to the right side, just because of exposures as a driver, and you see how that has affected his skin over time. The loss of collagen, which is the major structural protein in our skin and basically keeps it where we want it to be, and loss of elastin over time, and these elastic fibers that help to keep your skin, if you were to push on it, it bounces right back. That was the youthful ideal. So we know that sunscreen causes DNA damage. This has been very well demonstrated, and that DNA damage leads to signs of skin aging, but also things like skin cancers, including malignant melanomas. The collagen breakdown that occurs over time, a lot of that is due to the UV exposure that we accumulate over the years. Elastosis is this degeneration of elastic fibers and those, which leads to this loss of elasticity. Hyperpigmentation, which occurs as sunspots or melasma. Enlargement of pores is due to occurs as well, and sunscreen can protect against that. And exacerbation of inflammatory conditions like rosacea, melasma, and many more. So we recommend an SPF of 30 or higher. Some sunscreens are starting to adapt this an overseas rating so SPF pertains to your protection against UVB rays. We know we need to protect also against UVA and blue light, which could lead to hyperpigmentation. And we're starting to learn more and more about how blue light is having a negative effect on our skin. But UVA, you may see on some sunscreens, newer sunscreens, they'll have a PA rating. You want to look for a PA rating that has like 3+ or 3 to 4+. So it will say PA+++, as some of the brands in the US are adapting this. Mineral versus chemical sunscreen we'll touch on, and correct application is key. So you want to make sure that you're using enough product. We oftentimes will say 2 finger lengths is enough sunscreen to cover your full face for one application. Reapplication is very important. We usually say after about 2 hours, if you're out in direct sunlight, you should be reapplying. Anytime you get wet, if you're swimming or perspiring excessively, you'll want to reapply to make sure you're well protected. And this is also, of course, in conjunction with, you can use, UPF protective clothing, hats, etc., staying out of the sun between the hours of 10 to 2. And then commonly skipped body sites I want to mention. I see patients every day, of course, with sun damage. And a lot of times we see some sun damage in sites that I believe patients are just not putting sunscreen on. So make sure you're applying to the neck. In men, the back of the neck often shows significant sun damage. The backs of the hands is really important every day before you go out. The part of the hair and the scalp, as well as ears and eyebrows. This is a big one because I see many actinic keratoses and skin cancers right in the eyebrows. And I believe that's an area that we're just not getting the sunscreen. Mineral versus chemical sunscreen. So mineral sunscreens are what I generally recommend to my patients. These are those that have the active ingredients of zinc oxide and titanium dioxide. The benefits are that they're less likely to cause skin reactions because these ingredients are inert minerals. They have environmental benefits if you want to make sure it's either titanium dioxide or these non-nano zinc particles that are more reef safe. The downside for some will be that they have a heavier texture. Sometimes will leave a white cast. The tinted mineral sunscreens are maybe better for some skin tones, and they also offer the added benefit of blue light protection. But this is a physical barrier, so it sits on the skin and it reflects the UV rays off the skin. And it affords immediate protection. As soon as that product is on your skin, you're protected. As opposed to chemical sunscreens, so some of the ingredients that commonly we see here in the US, avobenzone, homosalate, octisalate, and octocrylene. We want to recommend that you avoid oxybenzone and octinoxate. These have been shown over recent years to have many downsides, including an increased risk of skin irritation or allergy, as well as a really detrimental impact on aquatic ecosystems and the reefs. The chemical sunscreens can be more appealing. They tend to be more of a translucent product, and they work by absorbing the UV rays and then transferring it into heat to release out so that it doesn't cause damage to your skin. And both mineral sunscreens and chemical sunscreens can offer very broad spectrum protection. Chemical sunscreens, because they do require this absorption for activation, you need to apply about 15 to 30 minutes before your exposures to the sun. And then let's move to topical antioxidants. So topical antioxidants are another essential skincare product that everybody should be using. I want you to use that every morning before going to sleep. And you could also use at night for added benefits. We'll talk about free radicals and how these are damaging our skin. So we are exposed to free radicals from many exposures in the environment. So UV light being a huge one, pollution, smoking, inflammation of many kinds. These can induce these free radicals, which are sort of, you can think of them as just kind of wild electrons that are looking to cause damage to your DNA and also to cause cell death in the skin. And this leads to the signs of skin aging and to skin cancer. So how does an antioxidant work? Well, an antioxidant is able to donate an unpaired electron to stabilize or neutralize that free radical, so it's not able to cause any of that damage that it would like to otherwise do. And antioxidants are very important as dietary supplements, but we know that, so, green tea, fruits, vegetables, all the superfoods that will get some antioxidants into our blood and protect us systemically. We do know that a lot of the time we get better antioxidant protection on the skin from topical products. We know that there are great topical antioxidants that truly penetrate the skin. They're very bioavailable and able to neutralize and stabilize those free radicals to protect our skin. Benefits, so we talked about how they're protecting against skin aging. They scavenge and neutralize the free radicals. Many antioxidants also have anti-inflammatory properties. And some of the examples that show up in our skincare products are vitamin C, vitamin E, ferulic acid, green tea, coenzyme Q10 or coquinone or ubiquinone, resveratrol, the red wine antioxidant, and niacinamide. And these are just some of my favorite products. So SkinCeuticals CE Ferulic is one of the oldest and very popular topical antioxidants. La Roche-Posay in the last few years came out with their form of a vitamin C serum, another great drugstore find. We carry Elastin products in the office, which have really great quality skincare products. And then the Skincare Junkie Megadose Super Antioxidant Face Moisture I am very biased about, but this one I developed so that we could have a great, very well-tolerated antioxidant for all skin types, including acne-prone and sensitive skin. Moving on to vitamin A derivatives, so retinol, retinoids, tretinoin, retinol alternatives like bakuchiol if you're pregnant and can't use a retinol or retinoid. There are many of these to choose from. Some of my favorites include the Elastin retinol line, Alpha Ret Overnight Cream by Skin Better Science. A great budget brand is the Rock Retinol Correction. And then tretinoin is a prescription that I often prescribe for patients for acne, and oftentimes patients will choose to use these for anti-aging benefits as well. So then these are all derived from vitamin A. Again, protects against skin aging. They stimulate collagen and elastin production. So anything we can do that's going to help to stimulate the collagen, prevent the breakdown of collagen by collagenase, and increase elastin production is going to help to keep our skin younger for longer. And as we talked about, we know that over time, these things are happening without our control. And because of the exposures that we have endured over decades or less. And so using a topical retinoid every night is very important. They speed up the turnover of dull outer skin cells. So some of the other benefits you'll see are a brighter, smoother skin, a clearer complexion, less visible pores. They can reduce breakouts, and it's a gold standard in topical treatment of acne. They decrease sebum production as well over time. Few tips, many patients will say, oh gosh, I can't use a retinol. I can't use a retinoid because I get, I have side effects. My skin peels, it's irritated. It's very important that you start slow and increase as tolerated. You want to use just a pea-sized amount for every application. Using more is not more effective. It's more likely to cause side effects and make it so that you cannot tolerate it. And the best way to apply is take that teeny little bit, dot it all over your skin with little teeny amounts, and massage it in. You don't want to, you should not feel like you're getting a full coverage like you would with a moisturizer. If you are, you're just probably using too much for your skin. Avoid applying to damp skin. Some of the common adverse effects: redness, peeling, flaking, sort of a tingling or itching sensation. And if you do notice any of these side effects, you want to pull back, start in a few days, and use when your skin is feeling back to normal, and use less and use it less frequently. And lastly is moisturizer. So we want to talk briefly about the importance of the water balance in skin. So dry skin appears duller and older. If you think of these, skin cells as being little balloons, if they aren't full with moisture, they're going to be a little more flaccid and less plump. Anything we can do to plump the skin cells will make it appear, younger and more youthful. Dr. Anolik spoke about Skin Vive and what that can do, and the benefits that can do for plumping of the skin surface. And that's just hyaluronic acid. So we'll talk a little bit about hyaluronic acid here. Hyaluronic acid is one form of a humectant. So what humectants do is they attract and they bind to water molecules. They can get those from the air, and also from deeper layers in the skin. Hyaluronic acid is able to bind about 1,000 times its molecular weight in water. Glycerin, aloe, there are many others, and these show up in skincare products, and we can utilize them to help moisturize the skin. And they do afford the skin this plumping effect. Occlusives are another great ingredient to look for in your moisturizer. These lock in that moisture. So the humectants can bring more moisture, bring more water where we want it. Occlusives will trap that moisture in so that it doesn't, it's not lost to the air through transepidermal water losses. Things like rich butters, shea butter being a very popular one, oils, including mineral oil, petrolatum, and lanolin. And even oily skin needs a moisturizer. So it's a common misconception that if you have oily skin, you should not moisturize. There's a difference between sebum in the skin and water content. Oily skin overproduces sebum, but that doesn't mean you have too much water content in your skin cells. So making sure you're cleaning off cleaning the skin, keeping the pores clean, and then moisturizing even for oily skin. And what happens if you dehydrate oily skin, you actually have a compensatory overproduction of sebum. So a vicious cycle. You should use a well-balanced moisturizer, one that's designed for your skin type. There are great moisturizers for oily skin as well as dry skin and anywhere in between. And you should be adapting seasonally as needed, especially when you live in a place in somewhere like the Northeast where we have very variable humidity levels over time throughout a year. And then skin loses its capacity to retain water over time. So as we age, our skin decreases production of the natural moisturizing factors that help to keep it hydrated. We see reduced sebum production over time. And as we said, the sebum can help to prevent water loss. The thinning of the epidermis over time leads to a reduced skin barrier function, and it makes us more vulnerable to that thinner outer layer of the skin is more vulnerable to moisture loss. And then changes in hormone levels over time, for example, with women as through menopause, the decrease in estrogen levels leads to decreases in skin hydration. And so just looking for facial moisturizers, those with oily skin should look for things like humectants, ceramides, and squalane, that they're less likely to clog pores, and those who are acne prone should be avoiding some of the other ingredients. So these are great for oily skin. Avoid fragrance, rich butters, oils, and vitamin E, which shows up in a lot of products like tocopherol isn't always the best for oily skin or acne prone skin. And then for dry skin, on the other hand, you're looking for those rich butters, shea butters, oils, as well as some of those other great moisturizing ingredients, humectants, ceramides, and squalane. And generally, everybody should be avoiding fragrance on their face, I feel. And then I don't know if we have time to talk about hyperpigmentation. Let's do it really quickly. So hyperpigmentation, over time, we see sunspots, melasma, post-inflammatory hyperpigmentation. This is a very common complaint that I see in the office. The best ingredients are these skin brighteners that work really well in conjunction with some of the in-office devices that we can provide. Inhibitors of melanogenesis is how they work. Hydroquinone, tranexamic acid, kojic acid, vitamin C, niacinamide, cysteamine, and alpha-arbutin are all some of the most effective skin brighteners, and they work best in conjunction with in-office treatments. How they work, really briefly, this is the process of melanin formation. So tyrosine requires this enzyme tyrosinase in order to get to that, to develop melanin. And we use ingredients that are tyrosinase inhibitors. So they block this enzyme in two spots in the melanogenesis production, and are able to prevent pigmentation from forming, and in turn allow those brown spots to fade. And these are just a few options we carry in the office: the SkinCeuticals Discoloration Defense, the Elastin Illuminate, and then the Skincare Junkie Discoloration Wand.
Beautiful. Thank you so much, Dr. Murphy-Rose. And I apologize to everyone we did go over. We just had so much to share and we tried to cram so many topics in. If you guys don't mind staying with us for another 10 minutes, we're here for you. Let's get through some of these questions. All right, this is a good question. I have this question too. Is there a way to tighten the skin under your eyes with lasers?
Yes. We use, there's lots of lasers you can use. The resurfacing lasers, especially both the Fraxel dual laser, which is the non-ablative, so you only have some redness and swelling. It does require several sessions. It's not a one-time treatment. The Fraxel CO2 laser, which is more aggressive, you get scabbing and crusting for at least a week or 5 days or so, has more tightening. It's probably equivalent to doing 4 or 5 of the milder lasers. And there's also, some people do microneedling. I'm not a big fan of putting needles by the eye, but you can do very superficially and get some tightening, especially like the festoons underneath the eye when people have larger bulges under the eye. It does help. And it's really wonderful for upper eyelid skin too. And the newer Maria device, we've been doing a lot of work on the upper eyelid in terms of just lifting up the brow and lifting up the eyelids. And these are non-ablative, so there's very little downtime to it.
That is great to
And
hear.
SoftWave, the ultrasound technology, is also great. I know Dr. Shelton agrees. No downtime and some great results.
All right, how about bags under the eyes? How do you improve them?
It depends on the cause. The cause could be, it could be fluid, it could be fat. If it's truly fat volume, then it could be removed by plastic surgeons. If it's excessive, remember, it is normal to have fat under the eyes. It does serve a purpose in terms of protecting the eye. But what happens as we get older, and Dr. Allen didn't touch on it too much, but when you get older, we lose the fat below the fat pad. So the fat pad actually appears larger than it really is. It's always been there since you were little for most people. But as we lose the fat below the fat pad, that fat pad appears larger. So some people will just go ahead and put some filler in the area below that, and it actually lifts your cheek back up. And then all of a sudden the fat pad doesn't look as prominent. So that's a simple solution if it's suitable for that person. We can also use microneedling and other lasers also to help tighten the skin down.
All right, Dr. Murphy-Rose, here's a good one on skincare. Can you specify the order that you should use morning products and evening products?
Absolutely. So if we're talking about the skincare essentials, like I said, you would cleanse if you're going to cleanse in the morning. The next thing that goes on your skin should be your, very simply, your topical antioxidant, your moisturizer, and lastly, sunscreen. Makeup, if you use it, would be the next step. At night, wash your skin. The PM cleanse is most important because you really want to get all that product off from the day. Everyone should have sunscreen on, so you got to remove that, any makeup, residue, etc. The first thing to touch your skin next would be your topical retinoid or retinol. After that, your moisturizer, and that's it.
Okay. So how do lasers and microneedling compare with the lifting benefits to something like a lower facelift, which we also offer at LSSC?
The lower facelift is the most dramatic. The other tightening devices, Dr. Shelton can speak about more. In terms of microneedling and lasers, it's a very small amount of lifting. It's not a lifting process. It's more about texture. And the difference between microneedling and lasers is there's less downtime. And it's better for darker skin tones in the sense that they have less risks of pigmentation changes to their skin following laser treatments. But in terms of tightening and lifting, that's more for things like soft wave and thermage and therapy techniques that try to tighten the skin from below.
All right.
If I may add to that, and well said, Dr. Bernstein, there may be a little bit of hype on the internet in terms of microneedling and tightening and lifting. So I definitely see tightening of the skin, but more of a minimal level where we're trying to improve fine lines and acne scars with microneedling. But that tightening doesn't translate to lifting in my clinical experience. And that's where we rely on, if we're doing non-invasive, to do the high intensity ultrasound like soft wave dental therapy.
But that's another reason why LSSC is a good choice to come in as a consult, because you could try some of these non-surgical treatments like lasers or microneedling with any of the doctors here. And then if it's not enough for you, or if you feel like you need the next level, we have 2 amazing board certified plastic surgeons that could consult with you and talk about the pros and cons.
Right.
So here's an interesting one: IPL versus lasers for treating brown spots on the chest.
I'm 100% laser. We don't use that many IPLs in the office. And the reason is an IPL is not a laser. An IPL is an intense pulse light device. So it's a diffuse beam of light that goes into the skin, and it targets a lot of things at once. We prefer to use particular lasers for particular problems. So if it's a brown spot, we have particular lasers for brown spot. If it's for redness, we have lasers for redness. If it's texture, we have lasers for texture. It does a lot more effect per treatment than the IPL devices. Having said that, the biggest complications we see are from IPLs are misused, that they leave giant patterns of whitening of the skin or burns on the skin that match the pattern of the device with lots of gaps between. Not my choice. For chest especially, it's very important to be careful with pigmentation, and we use the Fraxel laser, the Fraxel dual laser, as really a first-line treatment for that brownness. Even though it's a texture laser per se, it evenly removes the surface of that bronzing that you get from being in the sun way too much. And you see that when you take off your shirt and you see that perfect triangle of sun damage. If you use the lasers that work really well on brown, and a particular brown spot within that patch, you end up getting white circles. So we treat the whole area to get rid of the background color before we treat the individual brown spots. So lasers are better, in my opinion.
And this is
Well-
a common question. In fact, just today I had a patient, this comes up a lot, and it's the same answer. We have better lasers, better devices to treat the brown spots, and better devices to treat the red stuff. The red areas, you're going to get more efficacy from treating that way rather than doing the IPL.
However, I would like to say the jury's still out. As both of you, I do a lot of lasers, but we do have BBL here as opposed to IBL, broadband light, and the Cyton Hero BBL is extremely promising, I think, to treat the background redness, as well as some of that Milky Way, as I call it, browning, that you may have difficulty finding one spot for that one laser. Fraxel Dual works great, V-beam works great, but with BBL, we have seen good improvement also. So stay tuned.
Very cool. All right. Here's an interesting question. So are there any potential downsides to fillers, which we often don't talk about? Filler migration or delayed sensitivity, is that something we're seeing in patients?
We,
Go ahead.
at our center, I mean, is Dr. Anolik on? Is he answering?
No.
So at our center, I think all of us have seen patients coming to us who have had even complications elsewhere. And in our own patients, it's not 100% science. Some fillers will overabsorb, some fillers will move to a slightly different area. And there can be other things such as infections. Person had filler, a week later, they might have some dental work, and that bacteria that seeds into the bloodstream through the gum line could then find its way towards the filler and seed there and create a problem. So we do see things, and I'll let my colleagues speak to other issues that they've seen.
I mean, obviously the biggest risks, the concerns we have with fillers are injecting into a blood vessel and causing something called an occlusion, which is an extremely rare problem. Allergic reactions are very uncommon with fillers. We use mostly the hyaluronic acid fillers in this office. There are permanent fillers, which we see complications from all the time from outside our practice. We don't use in this practice at all. And they look great when they go in, but they can have complications 15, 20 years down the road, which become very problematic to come out. Actually, we just, interesting enough, I can't comment too much on it, but we have seen something that may help those patients with chronic granulomas or problems with silicone injections. That's down the road though. The main thing though is infections are rare, occlusions are extremely rare, but can happen. The biofilm reactions that Dr. Shelton just mentioned, the infections are possible, but we try to avoid doing it in patients 2 weeks before, 2 weeks after dental work.
And I think in general, this is why we recommend that you go to a board certified dermatologist for this sort of treatment, because, you know, like some of these doctors said, a lot of patients come to us after being treated somewhere else by usually not a board certified dermatologist, and then we fix it. So if you can come to the right place from the start, you're much better off. And
Or a
Dr.
plastic surgeon.
Yes, or a plastic surgeon. And Dr. Murphy-Rose, are you going to say something?
I was going to say exactly what you just said.
Okay, perfect. All right, few more questions here. So what treatments are available for body laxity, like knees or thighs?
Thermage and soft wave, in addition to microneedling with radiofrequency that we sometimes add as a combo package.
Got it. And those are very unique, specialized treatments that very few places are offering around the country. It's very innovative treatment. All right. Do you recommend a BBL laser or V-beam, or what do you recommend for facial redness?
You can, as Dr. Shelton mentioned, BBL could be used. I don't use it myself, so I won't comment on that. But the V-beam lasers and the XLV lasers are the workhorse lasers I use for treating blood vessels on the face, and they respond quite nicely. You can get some redness and some swelling after these treatments, though. That can last for a day or two, sometimes up to. We've seen patients have swelling for up to a week, which is unusual, but can happen.
I agree.
And they respond nicely. They also require, sometimes multiple sessions. It might not be a one-time treatment. Might have patients come back a month later and retreat. Some patients will be cleared for 6 months. Some patients will be cleared for 6 years. But rosacea, which is a common flushing problems that we see with patients, that it's more genetic and that will come back. The more you're in the sun, the more sun damage you'll have, and more frequent will we do treatments.
And since I'm assigned to skincare here, that's very important for rosacea treatment. So you could do a ton of laser treatments. If you're not taking care of your skin the right way, it's just going to come right back. So sun protection with a mineral sunscreen being one of the most important things you can do to help protect yourself, protect your skin.
One thing we go over really quickly, just a common thing that we see in our patients, or a concern we have in patients. There's very few things that are done in one treatment or done one time and guaranteed to have effect. Everyone is different, and everyone has different responses to laser. Some people have, as we say, the home runs, and one treatment they're like great, and some people it takes 4 treatments to get to that same point. There's a high variability from patient to patient, age to age, and we never make a promise that one thing will be the solution for everybody, but we definitely have lots of what we call toys in the office that we can use, and we have a lot of tools that we can use to help improve patient skin.
Absolutely. Okay, there's so many questions. We can't get to all of them. You guys can upvote them if one you really want me to ask. So here's a good one. How about what kind of lasers or treatment options do we offer for scars from surgery, or even hypertrophic scars?
Well, again, lasers work wonderfully. We use a combination of things. We use early on. I mean, even same day of surgery, you can actually use lasers like the pulse dye laser, the Fraxel lasers, to help improve the healing of the wound after a scar is formed. And one of the early lasers we like to use is the pulse dye laser, which helps to flatten the scar, helps reduce the redness of the scar. It helps a little bit with remodeling the collagen of the scar early on. We'll combine that often with injections of cortisone, which helps flatten it. Sometimes we'll combine that with another medication called 5-fluorouracil, and these all help the scar flatten faster. And in the end, we might use Fraxel lasers to help improve the final texture to make sure that we can make it as smooth as possible, which works great for stretch marks as well.
Fun fact. But yes, we have lasers, and this is why we have over 100 lasers in the office. So whether it's the redness you want to get rid of, or the texture, or the rays, all the things that Dr. Bernstein said, we treat a lot of scars. Patients actually fly in from all over the country and even all over the world specifically for scar treatments with us. All right, this is an interesting one. Do collagen pills or powders actually build collagen? Do they work?
I love that question. Comes up a lot, actually. So here's the thing about collagen supplements. When you ingest collagen, or any protein for that matter, it has to go into your belly. It has to be broken down into individual amino acids and put into your bloodstream, and then delivered to where we want to use it, whether that's the skin or you name it. The body just doesn't know that the amino acids that you put in your body were from a collagen supplement. So I always say, just make sure that you're, you have a well-balanced diet with sufficient protein. Most protein sources are going to do just the same as the collagen supplements will. Another point to that is that some products will say that they contain topical collagen. Just know that the collagen does not penetrate your skin, so you can't push collagen into your skin.
Very helpful. Okay, here's another one. What is the best filler choice for temples? And maybe before you get into that, you could talk about why people treat temples, because it's an area most people don't realize we treat. You want to take that?
I mean, as we get older, when you're a baby, you have nice bulging temples, and then when you're in the teens and 20s and 30s, it's nice and flat. And as we get older, like me, you start getting depressions. You get a hollowing of the fat, and this is natural fat resorption as we get older. And you can use lots of fillers. I mean, you can use hyaluronic acid fillers. You can use a non-filler called Sculptra, which is really just a collagen stimulant that you can inject in there and develop your own collagen from that product. Sculptra is that we didn't talk about it much with Dr. Anolik, but Sculptra is the same material that we use in dissolvable sutures, and we inject it in like a solution, and the body reacts to the small particles and creates its own collagen. It takes a little longer. It takes a couple of months to see the effects, so it's not instantaneous like you see with hyaluronic acids, but works beautifully in this area. So a lot of people have been moving towards Sculptra to kind of have the person's own regenerated collagen, but you can use a standard hyaluronic acid filler just as well.
And to add to that, there are some patients that come in wanting to improve their appearance, and they can't put their finger on it, what bothers them about it. And these particular patients will actually have kind of a cachectic look. They are skeletonized. The arch of the cheekbone here is so prominent because they've wasted so much of the temple volume that they are skeletonized. And just a little judicious filler done safely, because it is a risk area, can absolutely reverse the time.
Very cool. All right. Few more questions. Thanks for sticking with us. What have you guys seen so far with Avelli results to treat cellulite? Our patients been happy with it?
Well, I've done minimal cases with Avelli, and my patient and I have been very satisfied for the immediate improvement, but there is more downtime with that than a non-invasive treatment for sure. So somebody has to, first of all, not do it 1 month before bikini season. And you have to expect that you may bruise and have swelling for a couple of months. It's a little bit tender to sit sometimes for a couple of days. But depending on their swelling, we might be able to do another session several months later if needed.
An alternative to that treatment is also the sulfina. I know we don't treat it as much as we did in the past, but sulfina is still around. It's a good technique. It's very similar in terms we break the fibrous bands down, but similarly, you do get some bruising and some swelling for a little while. And we tell patients it's going to take about a month or two to see the full results.
Mm-hmm.
Very helpful. All right, this is an interesting question for you, Dr. Murphy-Rose. So how about plant-derived retinols? And a lot of people are asking about, does it have to be a prescription retinol, and the differences in the concentrations and what you recommend?
Sure. So plant-derived retinols, there are some ingredients that have been shown to have retinol-like activity. They probably aren't going to work as well as a prescription, but some of them can work as well as, the cosmetic retinols. And so certainly an option is, especially if you're looking, if all natural plant-based ingredients are your preference. And some of these have very good data to suggest that they have some of the same benefits that retinol does in terms of boosting collagen production. I believe that most of the data that I'm aware of suggests that nothing will boost elastin production as well as the prescriptions do. So that is the key benefit there, and they are stronger, but certainly many skin benefits to all the forms of ingredients that will boost collagen. And then the other part of that question was the
percentages that you recommend.
That was sort of touched on, right? Yeah, for that reason. So, but if you are new to retinols, I would recommend starting with something gentler, like an over-the-counter cosmetic retinol, or come in and speak to us and we can help to recommend based on your skin type.
Okay. All right, let's wrap up with one final question. I think this is a really fun one. Someone said, what is an example of doing all the things in one visit? So maybe we can talk about, what does that mean? Can we do multiple things in one visit? What are people doing when they come in and to kind of get their bang for their buck in a single visit?
Well, some of the things require some preparation in terms of numbing. I mean, certain procedures we do will require like an hour or so of numbing time. So it also depends on schedules. But you can do several procedures laser wise, and even fillers and Botox types filler treatments all the same day. Some bigger procedures like the soft wave, I think, takes a little bit longer time wise. Rasonic is a treatment for cellulite, takes an hour or so to do. These are procedures that sometimes we're limited by time, but you can do lots of things at the same day if we're prepared for it. What do you say, Ron?
There's certain things that we do tend to avoid. Like, we don't like to inject fillers when there's any open wound created at the same time by another treatment. And we may not inject a toxin such as Doxify or Botox in an area that's just been treated by a laser that's going to cause swelling and maybe make the toxin diffuse to a wider area that we don't want its effect in that location. So that's why the consultation is very important.
And sometimes we have people that are patients traveling from overseas, and we are able, they're not going to be in town for so long and they don't mind a bunch of things all at once. So that's always a possibility, but, based on independent cases.
All right, that is amazing. Tried to answer a couple more questions here, typing. A lot of people are saying thank you so much. It was a very informative session. I know we went over a little bit on time, but we really did get through a lot of questions, over 50. And we had 4 of our amazing dermatologists to present today. So I really appreciate you guys for staying on and speaking to us after your long day of patients. For all of you that stayed on until the end now at 7:30, we really appreciate you. And I really hope we got to at least some of your questions. Otherwise, we encourage you to follow us on social media, and you can submit some questions there. And you can always send them also in a contact form on our website, and we'll try and get to as many as possible. And maybe we will have to come back with another webinar, maybe even just an open Q&A webinar next time, if it helps.
Great idea.
But overall, thank you, Dr. Bernstein. Thank you, Dr. Murphy-Rose. Thank you, Dr. Shelton. And thank you, Dr. Anolik. And we hope you all have a great evening. And we hope to see you soon at the Laser Skin Surgery Center of New York. Thank you.
Thank you.
Thank you all. Be safe. Thanks, Risa.